that has something called femoral acetabular impingement.
FAI, for short, is a condition in the hip bone that causes pain in young patients. For Heath Ensminger, over time, the pain became debilitating.
Even taking my son to the park, by the time he was out of school, didn't even have it in me to walk over to the park to take him over to play.
Hip preservation surgery treats FAI, but leaves nearly a third of its patients with an entirely new injury.
You never want to take a patient to the operating room and trade one problem for another.
During surgery, traction is necessary to help open up the hip. In the process, the equivalent of a 75-pound kettlebell is placed onto the patient's groin, which can cause
issues with sexual dysfunction, numbness and tingling afterwards, or even tears from the post being on there. It's definitely a discussion you have to have with your patient before the procedure, and as you can imagine, I don't have to have that discussion anymore.
It took experts 20 years to develop a new way of getting traction, using a table called the Stryker Pivot Guardian.
We're just using this pad, and we tilt the bed down a little bit, and then the weight from the patient is enough to prevent them from being pulled off the bed instead of using the post.
With this new table, patients no longer have to choose between living with hip pain and taking their chances with a 70-pound weight.
My son and I, we like riding bikes, we have horses. Me and my son can do that now again. It just made a difference in everyday aspect of my life.
Interesting. Dr. Tannenbaum encourages patients 50 and under that have hip pain to see an orthopedic specialist. He says he often sees 60-year-old patients who could have avoided hip replacement if they had hip preservation surgery 10 to 15 years earlier.